Hello everyone, my name is Erik and my partners are Aim and Sydney. We will be talking about our program development project, a how-to guide for developing cultural and linguistic competency in brain injury programs. We worked with 3 programs through MindSource Brain Injury Network. The first was Achieving Healing Through Education, Accountability, and Determination, or AHEAD, which is a program that was created to provide individuals who have screened positive for traumatic brain injury with the insight and tools to better cope with and address the symptoms that they deal with. The second program was the Peer Mentorship Program, which is for individuals with a brain injury who would benefit from having a mentor who also has a brain injury. Mentors are trained to help their mentees explore resiliency, define what is meant to thrive, and then take the appropriate steps in that direction. The third and final program that we worked with was the Self-Advocacy of Independent Life, or SAIL, which is a small group multi-session course created at Craig Hospital for people with a brain injury. It is set up as a 6-session course with 2 follow-ups, but can be done in as little as a one-day workshop. The focus is to establish goals for self-advocating in a variety of settings to get their needs met. This program development project began with an assessment of the current cultural and linguistic considerations applied by MindSource programs that are focused on helping people with brain injuries in Colorado. With the guidance of Regina Rodriguez, the Diversity and Inclusiveness Coordinator for MindSource, we discovered cultural and linguistic needs in our 3 chosen programs. Specifically, we discovered a distinct lack in addressing equity, diversity, and inclusion. By speaking with the program leaders, we learned that the extent of the cultural and linguistic needs were driven by a lack of diversity of participants in these programs. Additionally, the program leaders have been operating under the assumption that their program facilitators are doing what is necessary to provide best service to participants. In order to address their cultural and linguistic needs, we decided to create a way to weave the national culturally and linguistically appropriate services or class standards into these programs. Together, AHEAD, Peer Mentorship, and SAIL programs seek to provide all community members within Colorado who have a brain injury with tools and strategies to better cope with and address symptoms, support survivors through peer mentorship, and assist them to establish goals for self-advocating in a variety of settings. However, due to their inability to meet diverse cultural and linguistic needs, they are unable to effectively serve diverse people in Colorado with a brain injury. As soon-to-be occupational therapists, we are focused on creating and facilitating opportunities for people to engage in occupations that lead to positive outcomes. We believe that these programs need to adopt an occupational therapy strategy, as they are currently not providing enough culturally and linguistically sensitive materials to assist culturally diverse community members with brain injuries to work in a truly supported fashion toward achieving positive life outcomes. Here is a brief look at our logic model. The rest of this presentation will take you through each step, leading to our final impacts.
I'm Aim, and I will be taking us into a closer look of the resources and inputs and how they shaped our goals and activities. The first resources we consulted were the class standards themselves, along with the glossary of equity terms, both of which were provided to us by Regina. This was the first step in familiarizing ourselves with cultural competency. The standards were ambiguous though, so we looked for other resources to help clarify them and found the National Culturally and Linguistically Appropriate Services in Health and Healthcare, a blueprint for advancing and sustaining class policy and practices, or as we called it, the Class Standards Blueprint. This document broke down every standard in full detail with purpose, strategies, and resources for healthcare providers. The next step was to start looking at the program resources themselves to determine which standards they were already addressing, if any. This included the AHEAD and Peer Mentor manuals and the participant workbook resources for SAIL, as well as an Excel spreadsheet where program developers and leaders answered questions regarding their programs. These were missing information though, so we turned to the program experts. Karen Farrington with AHEAD, Saya Curtin with Peer Mentorship, and Lenny Hawley with SAIL. Finally, we looked into current research discussing the importance of cultural and linguistic diversity and inclusion and the challenges faced in training and implementing techniques to providers. With these resources in mind, we formed our goal to create and provide an appendix that clearly explains the purpose and strategies for all 15 class standards to promote cultural and linguistic competency among any brain injury programs associated with MindSource. Next up on the logic model roadmap is the activities and objectives that allowed us to reach the overall goal. You might notice that standard number 1 is not addressed here. This is because the class standards are designed in such a way that to meet standard number 1, all other standards must be met first. So by focusing on 2 through 15, the ultimate standard of providing effective, equitable, understandable, and respectful quality of care and services that are responsive to diverse cultural, health, beliefs, and practices, preferred languages, health literacy, and other communication needs falls into place. Activity number 1 is to develop strategies for meeting standards 2 through 4 to ensure the brain injury programs with MindSource have cultural competency training, leadership devotion to cultural and linguistic competency, and staff representation of the program populations. Activity number 2 looks to develop strategies specific to these programs for meeting standards 5 through 8 in order to ensure communication and language needs are being met by both current and future programs. This is including accessibility to all aspects of the program regardless of any language or communication differences. Finally, activity number 3 is to create strategies to meet standards 9 through 15, which encourage persons involved in the brain injury program to take opportunities to engage, continuously improve, and hold these programs accountable for providing cultural and linguistic appropriate services to communities. This brings us to the output part of the journey. When assessing how to shape this document, we reviewed the needs of each of the 3 programs as well as MindSource to ensure we were making the best possible final product. The needs ended up being a universal design, simple modifications and standards change, and the ability to be added to future programs. This would allow for one document to be added at the end of any and all program manuals that could be updated without needing to do full manual rewrites, which is timely and costly. To meet these needs, we created one generic appendix, a how-to guide for developing cultural and linguistic competency in brain injury programs, strategies for meeting class standards. This document can be added into the end of each manual or standalone. We wanted to ensure any facilitator with the manual understood the standards, their purpose, and how the strategy and had strategies to implement them. This class standards blueprint was looking like the right idea as it's nationally recognized. However, it can be inaccessible and cumbersome, especially for quickly relaying the information to new program providers. So we chose to modify it. We condensed the information down to the essentials and added resources specific to the brain injury and MindSource, along with helpful tips and tricks. This makes it more accessible, easy to update, and helps to ensure needs are being met for all participants regardless of their cultural needs.
Hello, this is Sydney, and I will be diving into the next part of our model, the outcomes. So our first outcome is that staff and volunteers will learn how to anticipate and accommodate diverse needs. The appendix conveys the importance of cultural competency training with the class standards 2 through 4, which you saw from our activities in a few slides prior, and it offers resources available in the community for high-quality training based on current best practice. So if these brain injury programs choose to promote and encourage ongoing cultural and linguistic training amongst their staff and volunteers, they will become more equipped to anticipate and accommodate the diverse needs of their population because they will have a better understanding of different cultural values and beliefs and the importance of accommodating those needs. So our second outcome is that brain injury program leaders will be able to meet the executive order from Governor Polis directing state action for equity, diversity, and inclusion. So in the executive order, it specifically states that in order to achieve our vision of a Colorado for all and equity for all state agencies must play a role in incorporating an equity mindset in their work. State agencies are directed to take a coordinated approach, led by DPA, to operationalize equity in systems, policies, and practices, end quote. All class standards were specifically created for agencies to promote equity, diversity, and inclusion through changing policies and practices and ensuring that individuals on every level, including leadership as they're the ones creating policies and systems, participate in this process. For example, strategies for class standards 5 through 8 in our appendix suggest that in order to improve accessibility to the program, communication needs must be met through the use of trained interpreters and translators and easy to understand print and multimedia. This, along with the other class standards, specifically addresses Polis's executive order for increasing accessibility. If staff and leadership use this appendix addressing all class standards, they will be able to achieve the vision of a Colorado for all and equity for all as outlined in the executive order. Our third outcome is that staff will be able to quickly reference a practical document for easier implementation of class standards. Having an organized, applicable document with strategies and resources will make it easier and more likely that programs will take the time to implement class standards. Having an appendix with step-by-step instructions and suggestions to quickly reference will eliminate the possibility of a program feeling overwhelmed by the vastness of cultural and linguistic needs, and will standardize the process for increasing cultural and linguistic competency within brain injury programs in the future. And you can see a little snippet of our appendix here on the left. That's just the intro page, a little example of what it looks like. Now we're going to take a look at the next step in our logic model, which is the impact. So by achieving the anticipated outcomes, number one, the programs will be more accessible for all potential service recipients who could benefit from this program because, quote, culturally and linguistically appropriate services are increasingly recognized as effective in improving the quality of care and services, end quote. When program leaders improve the accessibility of a program, they recognize that the program needs to take diverse cultural and social factors into consideration when designing applications, advertisements, and websites promoting the program in order to create more opportunities for a wider variety of individuals to access the program they are offering. For example, eliminating language and communication barriers targets these contextual factors to enable diverse participants to access this program. The second impact is that service recipients will have their cultural and linguistic needs met within the program, which will increase their ability to participate throughout the whole entire program. And ultimately, this is what OT is all about, tearing down barriers, whatever they may be, in order to promote meaningful participation. Ultimately, when service recipients have their cultural and linguistic needs met, they will have a better opportunity to benefit from the program and more easily and comfortably participate. Now that we have taken you through our logic model, we hope that we were able to convey how each step helped us ultimately reach our outcomes and impacts. We believe that using our evidence-based resources assisted us with completing the activities necessary for creating our appendix. Because each activity helped us create strategies for each class standard in the appendix, ultimately the appendix will be able to help staff and volunteers have the necessary strategies and resources for addressing cultural and social factors that could potentially be barriers to service recipients' ability to fully participate in the program.
Hi, it's Amy again. While we worked hard to ensure our how-to guide is as user-friendly as possible, we recognize there are still potential barriers for the individual programs when implementing them. The first is the cost associated with obtaining interpreters, having documents translated, printing and reprinting materials in multiple languages, and others. Discussing these concerns with Regina, MindSource is prepared to assist programs to help lighten the cost burden with a variety of resources. We also learned through our research articles there is a real need to work on training programs for cultural competency. Currently, the trainers themselves do not have full understanding, which is hindering their ability to pass the knowledge on. There is also yet to be a best practice developed for training new practitioners. Finally, organizations are not making the necessary systemic changes to implement long-term changes. If individual practitioners are the only ones receiving training and implementing change, then the change will never fully take hold. This is why we believe that helping these brain injury programs implement these class standards is valuable. This will help ensure that all levels within the organization are doing what they can to provide positive change that impacts the services participants experience. We want to sincerely thank Regina, MindSource, and Pat for allowing us to be part of this project and making a real impact on the lives of individuals with brain injuries across Colorado. It has been a lot of fun learning and exploring the world of cultural diversity and inclusion through this project. Thank you again, everyone. And last, but certainly not least of all, this is a list of all references used in the creation of this presentation. Thank you.